So, Dr. Mike, you just explained to me a patient that came in here earlier today who had been in the hospital over the weekend getting treatment. And you kind of explained where you really helped him potentially really solve the issue here and what the core problem was, not just treating the symptom again. Can you give us a little more explanation, please?
Right, Carter. So he goes into the hospital and they diagnose him with asthma or bronchitis. Both of these are breathing conditions. You really don't have asthma or bronchitis without something actually causing this to happen. It's just inflammation in the lung area that constricts your breathing. So he spent 3 days in the hospital, and all they really did was they gave him steroids and antibiotics. And I asked him if they did any testing, and they said yes, they did blood tests while he was in there. And I said, did you find out that it was bacterial because of the antibiotics? And he said no, he didn't have that. He didn't have the knowledge that they did know it was bacterial. Anyway, so they gave him all these steroids and antibiotics because that's how they treat asthma or bronchitis. So when he came in here, I checked him out, and he had nothing going on bacterial. In fact, it was viral that was actually causing this. And so we did give him some supplements for the virus, so we can build up his immune system so that it can fight the virus by itself. And we'll see how he's doing, but he should be. Most patients are good with this type of viral condition on these supplements. They're usually good in about 48 to 72 hours. So he's going to come back in 2 or 3 days, and we're going to check him out again.
Great. So Mike really helping somebody treat the actual problem rather than covering up the symptom, potentially was all they were doing, and helping somebody really get healthy. Dr. Mike Munro, primary care chiropractic.